All right, guys, let's get after it. We've got a patient that's bleeding. Okay, so we're obviously going to start with March. We want to get some information from the NPC, right? His teammate here. Tell us what happened. So while we're getting
I'm glad you're
information, we'll start
here.
working.
I don't really know where to start.
Okay.
I didn't really see what happened. I just heard an explosion and came running. Found Robert down here like this.
Perfect. Okay, well, we'll talk to Robert, so we can talk to him just like we do any patient. We're going to go ahead and get that bleeding under control. So obviously our immediate intervention is going to be a tourniquet. There's tourniquets on the outside of the ruck. I'm going to take that. And then there's some more on the inside on the circulation, right? So the ruck is set up in kind of a march pause fashion. All right, and obviously like any tourniquet, if you place it doesn't work, what's the next thing we do?
I'm gonna place another.
Yep, great, there you go. I'll pass that to you.
Both my legs hurt real bad.
Yeah, so
And
you
my
can see it's
chest,
really
too.
effective to go ahead and hand and work as a team to solve these problems. Okay, so we're gonna go ahead and get him exposed so we can see if he's got any other injuries. One of the things we can also do is put gloves on if we've got the time to do that to protect ourselves. So you can grab that. You need to place, basically use your one hand to place it on the other. The trauma shears, I think you're able to only grab those. We can kind of then get the patient exposed, looking for their injuries.
Yeah, the shears are here on the ground.
Yep, perfect. And you can activate those with the buttons on the top of your handle, right? So just get in contact with the clothes and it'll cut them off. And then we can go ahead and rotate the patient. We can look and see if there's any downside injuries by grabbing on either side of the patient, the shoulder and their thigh. There's those, see those gray arrows? Yep. So you can do it either close to you and roll them away, or you can roll them towards. Obviously, it's ideal to roll a patient on their good side, not on their injured side. So in this case, it might be best to roll them towards our NPC here.
Okay.
So if you grab the arrows here by the shoulder and by the thigh,
Okay.
you need to do it with both hands as an individual. Yep.
As an individual, okay.
Yeah, perfect. And now we can look for any other injuries that the patient might have.
How do we roll them down?
Yeah, good question. So you go ahead and you'll go and you'll grab those same arrows and you'll just move it towards you, and the patient will roll back.
Oh, I gotta get closer. Because it's far away now.
Yep. So we've done a quick sweep looking for any external bleeding. So we've covered the M. We're going to shift to airway. We can talk to the patient to get some more information. So Robert, tell us, how are you feeling? Where are you hurting? What's going on?
It's hard to breathe. It feels so tight in my chest.
Okay, so his airway is open, but we're concerned about his breathing. So we can go ahead and we can listen if the environment allows. So we have a stethoscope here. You can go ahead and take that bell and you just go ahead and hold it against the blue circles. So you'll see those areas that you can interact.
Through my headset if I put it on.
Yeah, exactly. So you just have to make sure your volume's up, but you can go ahead and listen just like you would a real patient. You can listen to lung sounds.
I
You
can
can listen
hear
to.
them there, but I hear some here.
Yep. So what do you think's going on there?
Well, he can't breathe on this side, so I guess it'd be a pneumothorax.
Yeah, very good. Right. So what are we going to do for as an immediate action if we think a patient has a pneumothorax?
We gotta needle chest decompress this
Yep,
guy.
very good. Right. And so on the inside of our ruck, we have a couple places. We have it in the respiratory pouch, but we also have this on the inside for immediate access. You can go ahead and grab that needle, that long needle or catheter. You can go ahead and place that. Now you'll see some blue circles, the colliders that allow you to tell you where you can place it. There's two places that we can place the needle. And so in this case, you can decompress the chest, right? And so then we can reassess, just like we would for real, did the patient's condition improve, right? Or we have lung sounds? Do we have the ability to kind of see on a monitor? In this case, we can go ahead and, while we're working, put them on a little bit of limited monitoring capability. And the airway pouch is a
feel
pulse
like I can
ox, which will
breathe
give
a
you
little bit
continued
easier.
feedback. So that's good to have on the patient, just to have some limited monitoring capability.
I see a blue collider by his wrist. What does that do?
Yeah, very good. So that allows us to do pulses, right, to get a kind of a field expedient assessment of blood pressure, right? So if you've got good pulses and radial pulse, you can also see that in the femoral and then in the carotids.
Oh, I can feel it. I
Oh
feel
yeah,
the
it's
pulses.
shaking my controller.
Yep, very good. And that should coincide with what you're seeing on your pulse ox or other monitoring if you have it available. All right, great. So we've gone ahead, we've done some interventions. We can go ahead and reassess and listen for any changes in lung sounds. Go ahead and maybe see if that needle decompression helped.
Oh yeah,
I feel like I can breathe a little bit easier.
and of course,
Great.
you still hear it on the other side too.
Yep. Good. So we've worked through massive hemorrhage, airway. We've worked through respirations, through the needle decompression, and then circulation. We've assessed with kind of pulse oximetry, so we can look at and then also the presence of peripheral pulses. All right. So next, we're going to be talking about the H. So that's head injury, and also kind of hypo or hyperthermia, so we're concerned about environmental conditions. He's alert and oriented. We're talking to him. Robert, how are you feeling? Doing better?
That feels a lot better.
Good. All right. So from a neuro standpoint, he seems intact. We're obviously going to be mindful of the environment. If it should be raining or there's wind, we want to get him covered up. There you go.
Look
All
at
right.
that.
Yep.
It started to rain.
Yeah. So what we'll do, I think, real quick too, we want to go ahead and get IV access so we can give him pain meds before we put them all bundled up. So in this case, we go to the circulation pouch. You'll see an IV catheter, and you also see alcohol wipes. Right. We want to make sure we clean the skin a little bit before we go ahead and puncture the skin at all. We also have IOs if you need it. And let's go ahead and look at that functionality too, because the intraosseous needles, you have two different needle sizes there. You have the longer ones, kind of for the extremities. You have a sternal IO, which is the shorter one. But as you pick up an IO needle, you'll see blue colliders at different places where you can go ahead and place it. So you obviously want to use the alcohol wipe too in this case before you go ahead and.
I'll hand this one to you.
Yep. So are you seeing the different places you can place it?
Yeah, I see a bunch across his body.
Yeah, which is really powerful because that gives you the opportunity to make decisions. Where's the best place to put this is going to be based on his injuries, kind of how he's doing and access to it once you get him bundled up. So sometimes humeral head's good. If you've got a good lower extremity, that's fine, but certainly whatever access point you want. All right, great. Now we want to go ahead again, as we said, the H in the march is to kind of prevent any hypothermia. What we have here is a hypothermia management kit, or prevention management kit, and that's basically a warming blanket and casualty blanket in one. So yeah, you can put that on the patient. And the next thing, like, as we finish a case, we want to be able to get the patient moving, right? We want to get them evacuated. And in this case, we have a Skedco, which you can place under the patient to facilitate their movement, so we can pick them up and move them to an evacuation platform. Okay. Now you have other things that you can do from a diagnostic standpoint in terms of secondary surveys. We've got a flashlight here for looking at pupil responses. You can interact with the patient and ask them to do certain movements from a neuro exam. So there's that. The patient will follow that flashlight too. All right.
Look at that.
Now, one of the things we hadn't gotten to, now that we've got them nice and protected, we've worked through our primary and kind of our extended secondary surveys, we're going to go ahead and get medications, right? And so these are things that we might give along the way if we have time or have multiple sets of hands. And then in this case, we'll want to go ahead and administer some things, right? Some of the standard medications in the field are going to be any pain medication, you're going to be antibiotic administration, and also TXA and calcium potentially if you're starting to do transfusions. Now I'm going to hand you the syringe. So on the top of the joystick or on top of the controller is a joystick that allows you to kind of pull back and advance forward. That allows you to kind of control the plunger. Okay. So with that hand, you just got to keep holding it. You got to keep your trigger down so you don't drop it. If you do happen to drop any of these tools, they'll go right back to where they started. Yeah, so you'll see that. You can grab that. And then with the other hand, you're going to need to grab whichever vial of medication that you would like to administer.
I think we'll do some TXA first.
That's great. And then, so obviously you'll have to do kind of the math associated with, based on concentration and how much volume. In this case, it's going to be 10 cc's for a gram.
10 cc's.
Yeah, we'll typically administer 2 grams as a bolus. So you'd have to draw it up just for real. You'd have to, draw it from 2 vials.
And that was really easy, just pulling the trigger back.
Yep. And now, while you have the syringe, the needle, as long as the needle is intact on it, it's going to give you IM injection sites. So we're going to take the HPMK off just so we can administer the medicine. In this case, if the needle is still on, you're going to see colliders that allow you to do intramuscular administration, which is fine. If you take the needle off, then that'll allow you to then administer it through the IV or the IO site.
Okay. Close to the IV, so we'll go through there.
Yeah.
You're saying you're pushing this joystick forward now, and that's how you're administering it?
Correct.
Okay.
Yeah, and so certain medications which you want to go slow, you can control the rate at which you administer it. If it's slow IV push or something that may be rapid, say adenosine or something like that, you can adjust your rate based on like the real time elapse. Okay, so we would want to go ahead and we can continue to administer medication, but we do need to kind of get him back covered up so that he doesn't get cold. And then as we're kind of wrapping up the case, we'll want to call for an evacuation so that somebody will come and take our patient and get him back to a higher level of care. And so you can do that through the moderator. You'd ask for a evac.
This is Medevac 1. What do you need?
Why don't one of you guys go ahead and kind of pass word back to him.
Hey, Medevac 1, this is the ground medic. We need urgent pickup.
Are they stable?
Yes, Medevac 1, our patient is stable.
What treatments have you applied?
We have applied a tourniquet to the lower right leg, a needle chest decompression on the right side, and administered 1 gram of TXA and wrapped the patient up for transport.
All right, we can get a transport team to you in about 15 minutes.
Awesome, thank you.
Great work.
All right. What questions do you guys have?
I see that you're passing things. How are you able to pass things in this case?
Yeah, so our training allows us to just interact like we would not naturally in an environment such as this. So I can grab and hold and go ahead and pass any one of these devices, say in this case the needle. Obviously you want to make sure you don't poke anybody.
And I'd use that trigger button of my pointer finger, right?
Yep, correct. Yeah, so just like you were grabbing it out of the ruck yourself, you can go ahead and grab that and hold, which is really powerful in terms of asking for help and to kind of engage all of the team members.
What happens if I just happen to drop the needle or let go of this handle?
Right, so any object that you drop will end up going back to where it started, so kind of where its home is in the ruck.
Oh,
So
there it is.
Yep.
I'll grab it for you since you dropped it.
Oh, thanks.
Right. So one of the things that we hadn't gotten to, as you guys were so fast, is that we have the ability to do digital documentation, essentially train how we fight and doing it for real. So this tablet also provides ultrasound capability, but in this case, what we would do, you can place it against the patient's ID. So if you take the tablet,
Okay.
you'll see in his uniform, he's got a name tape that allows you to kind of start a patient entry.
Should I just place this over?
Correct. Yep.
Oh, there we go.
Yeah, so that'll allow us to kind of start the patient process. And in this case, you can go through and add, so if you kind of click and long hold on the individual, so you want to use your pointer finger, which is the button on top of your controller.
Oh, here it is, yes.
Yep. And if you push and a long hold on that patient's ID, the SM17, in which case it'll allow you to kind of open up a documentation. Now, just like the real thing, this allows you to go through sequentially all the different entry points. So in this case, we're doing mechanism of injury. It allows us to select the different types of injuries and to place them on the diagram mannequin of where they're located.
I see some sort of probe thing at the top. What is that?
Right, so that's the ultrasound. So if I press and long hold there, an ultrasound probe will come on top of the tablet and allow us to do point of care ultrasound.
Oh, wow.
That'll shift you from the BatDoc program. But then ultimately you go ahead and pick that piece up.
Here, do you want to pick that up, Ellen?
Sure.
And this will allow you to do different scans. And you'll see colliders where you can place the probe and it'll provide you an image.
Yeah, cool.
Right, in this case, they're primarily the EFAST, extended focus abdominal sonography trauma. And that allows us to look for free fluid in the abdomen. It look for pneumothoraces and even a pericardial effusion.
Okay.
So that'll allow you to do multiple things. And so going back to the BatDoc allows you to do full documentation. And then ultimately, just like for real, you can then take all of that information. It allows you to kind of put what meds, what treatments have been given. And you can kind of walk through that by placing and long holding on the side column. In this case, it'll allow you to, well, we're already kind of there, but it'll pull information through. This allows you. And all of these buttons are interactive with that index finger long hold. And so when you press on one of those things, in terms of this is, you know, you did, in this case we did a decompression. So if you want to go ahead and place that in the record.
I don't see it. There it is. And now we have needle D.
Perfect.
Lock
Yeah.
in.
Yep. And so, and then you should have a tourniquet application.
Tourniquet. Right leg.
Very good. Now we can go on to fluids and meds, and we can document anything that we have given. And then at the end of this, we can have it set so we can transfer as we do a handoff to the next echelon of care. This entire record can move with the patient. Again, the long hold allows you to document the different medications given.
And I just keep on pushing the button to get to where I need to go. And there we go, TXA. Cool.
And so, yeah, we've covered pretty much the basic functionality of the Valor program in all of the scenarios.